Hi everyone, I'm Dr. Corrielus, board certified cardiologist, community health specialist. That is, I bring my medical expertise to the heart of the community. I am a medical mogul. A few days ago, I came to you and introduced the concept of medication. Today, I want to go into a little bit more details about medications. But before I do that, I want to give you a little bit of a reminder as to how medication came about. If you recall, my dad died of heart failure when I was young. He had a very sick heart. I remember he struggled with heart disease. It was almost as if he was in a war and did not know how to defend himself. He did not know much about heart disease. Subsequently, he died of the condition. That experience spurred me to becoming a cardiologist. Fast forward 20 years later, as a practicing cardiologist, I realized a lot of my patients were almost like my father. They do not know about the condition that's ravaging the community. They don't know how to defend themselves. Out of that grew my purpose. That is to inform the community, to bring medical education to the community where it matters the most. If patients are empowered, they know better, they will do better. They will be able to be more compliant to doing what they need to do or what is being asked of them because of their conditions. Medication will do just that. Medication is medical education to the community. It's about empowerment. It's about empowering the community to be the best advocate. I believe that the cornerstone of healthcare is self-care. If patients are able to be their best advocates, they will ask the proper questions, they will ask the best questions that they can of their providers. Thus, they are engaged. When patients are engaged into their care, they are active participants, they are able to collaborate, they are able to do things that will help advance their health. And so, with medication, we will be able to provide all the different terms, all the different information in a way that you can understand, in a way that you can relate to, so that you will be empowered, so that you will be able to know why you need to do certain things, why you've been asked to do what you're asked to do. I'll give you a classic example as to why self-advocacy is so important. This is a personal example, and my sister will probably kill me when she hears that I am putting this out there. But my sister yesterday morning started developing some abdominal pain that became so severe that she went to emergency room. There, it was discovered that she needed to get an urgent operation. So from the emergency room, they were getting ready, they prepped her to go to the operating room, and the doctor called my niece to inform her that her mom was gonna go to the operating room. And I think my niece is going to kill me also. Of course, when the doctor called my niece, she was told the details that the mom is going to the operating room. She's going to get intubated. She's going to be put to sleep. I don't think that she was at that point where she was able to ask many more questions. Thus, she hung up the phone with the doctor and then called me right away. So when she called me, of course, first thing I asked her, okay, why they are going to operate? What's going on? What they're going to do? And for what? When? Those were my questions. And of course, she did not know. And understandably so. So that's where I stepped in. I called the emergency room and asked to speak with the doctor. At that time, my sister was already in the operating room. I proceeded with calling the operating room, and there the doctor was not available, but they had taken my number and reassured me that they would have the doctor call me, because I had asked them to have the doctor call me prior to the surgery, because I wanted to make sure before my sister goes under that the doctor knew that I am an advocate, that I'm there for her and making sure that I made the connection with the doctor. So sure enough, within minutes, the doctor called me back, and I was able to find out exactly what was going on through my pointed questions, and find out what was going to be done and what's to be expected. And at the end of the conversation, I was very comfortable with her proceeding to the surgery, and I thanked the doctor for calling me back, and I requested for a call back after the surgery to get a report on how the surgery went. And sure enough, after a couple hours or so, I got a call from the doctor that the surgery was successful, that my sister had done very well to the surgery. They were able to intervene and make the correction that was necessary. And she is now on her way to a full recovery, thank God. I'm giving this example to say that it does make a difference. It does make a difference, and I can tell you, being in the healthcare, when you are able to ask the right question of the doctors, when you show the doctors that you know what you're talking about, when you ask them pointed question, it makes a difference. It makes a difference, and a lot of times that may mean the difference between life and death. And I have seen it in my 20 years of clinical practice. I have seen bad outcomes as a result of patients not having either had the best advocates on their behalf, or them not being able to advocate for themselves. So my impetus is that we have to we have to intervene. We have to make a difference on that front. And so, as a cardiologist, I know heart disease is the number one killer in the community. Our community is dying disproportionately of heart disease, and the manifestation of heart disease and heart failure. So it is my mission to put a dent in that devastation to empowerment, to your empowerment, the empowerment of the community. Because if you are able to be well informed and you are able to speak for yourself, advocate for yourself, I believe that we can change the outcome. And so until we're able to fully evolve with Meducation, I'm going to leave you with 3 tips as to what you can do right now to be able to prevent heart disease and help you lead the best life that you can. Number 1, you need to stay informed. You need to be informed. If you have a condition, get informed, get as much information as you can about the condition. If it's heart disease, learn about it. Learn about heart disease. If it's hypertension, if it's diabetes, learn about the condition. There are many ways of learning about it now. Of course, with Meducation, we're going to bring more information at your level that you can comprehend, that you can really intervene on. But certainly, learn about your condition. Take every moment, every opportunity to learn about your condition so you will be well informed. Number 2, choose your providers wisely. That is, your providers are going to be your counselors, but choose them wisely. When I say that, meaning that you need to have someone you can connect with, someone who you can relate with, someone who empathize with you, who can understand where you are and meet you where you are. Because healthcare is about relationship. It's about the relationship that you are able to develop with your provider so that you are understood and the provider is able to understand the nuances of your circumstances, because there's a lot of factors that come in to play when it comes to your healthcare. Some of it is cultural, so some of it is social. So we have to take all that into consideration, and your provider has to be able to put all that into consideration, and that is something that you need to be cognizant of. And so when you are choosing your providers, you need to think about choosing your providers who's able to connect with you at that level. And lastly is really take accountability. You have to take accountability. You have to do your part, okay? It doesn't matter if your doctor is Harvard graduate. If your doctor is not able to talk to you or connect with you at the level where you can understand, if your doctor is not able to really come to that level where he can inspire you, can drive you to be the best, to take the best health, to get the best care of yourself, then you are not better off. So that's where you have to question that relationship. And at the same time, so again, taking accountability, that's your doctor having that connection is able to really drive you and inspire you and provide you with that really that empowerment that you need to be able to make the next leap into a better health. And so that's the formula that I want to leave you with. And that's where Meducation will come into play to being able to help you be the better person, a better health that you can, to be not only there for yourself, for your family and your loved one, and also, most importantly, your community. Again, this is Dr. Corrielus, board certified cardiologist, your community cardiovascular specialist, coming to you with Meducation. Stay tuned.